Welcome to this session. I've come to some conclusions recently that I think you might be interested in. I've been experiencing skin problems, flaking, pain, itching. I was asked to go to a dermatologist and went there, and the interaction was interesting. I walked in when I was waiting for the doctor, and when the doctor came in, the first thing I said to him was, I'm interested in cure. I'm not interested in palliative measures that leave me just as sick as I was when I came in. He said, I will not discuss alternative health methods. I said, fine, but I want cure. And we went through the usual stuff and the prescription, which ended up rather frightening me. And then he said, in a rather thoughtful vein, this looks to me like contact dermatitis. I have now eliminated ringworm as a possibility. And all I really know about these things is they're usually a combination of a yeast and a fungus. And I wish I could give you more, but that's all I have. And I thanked him because it helped. Now, I know a little bit about fungus because I've been dealing with athlete's foot fungus for many years. Toenail fungus. And I believe most of the cures for this basically involve zinc. Zinc has to be available, and I guess it kills the fungus. So I decided to try that. We got zinc oxide powder. It's just a white powder, and I have found ways to apply it directly to the skin, and I have used oils for that. For example, today after showering I put tea tree oil on this arm and then rubbed in the zinc. I think it's helping. And I think that this is eventually going to take care of the issue for me. Recently my tennis has improved dramatically. In fact, I was able to solidly trounce my favorite partner, who's been my partner ever since I started tennis out here. He looked a little depressed. Not my problem. And I suspect I will continue to develop. There is a feeling that I am faster on the tennis court. Not just necessarily faster running, but faster to react. Suppose I'm here waiting for the serve and the ball is served. If this were my body 1 month ago, the ball is served, and then for a good 1 second I am unable to move. Now, you know, I know, everybody knows, if you're going to wait a full second after that ball is served, you might as well go home. You can't play tennis. You don't have that much time. Well, more recently, since working on the skin problem, my reaction times are faster, and they continue to get faster, and that's really interesting. This leads me to discussions of slow twitch and fast twitch muscles that I've seen. I know that in the past I have always done what I think would be called only slow twitch exercises. Jogging, swimming, things that are repetitive and involve basically slow if constant motions. Bicycling, same thing. Never sprinting. But tennis is different. That movement of the racket is fast. And the reaction times have to be quick. What does that have to do with skin problems? Well, the signals to a fast twitch muscle have to come from the meridians. Nerves are just too slow for that. And hormones are even slower. The meridians are fast enough. It's a fast network. But if there is some kind of severe infection within the skin that will paralyze the meridians, then, well, the fast twitch muscles are not going to be very fast. So this suggests that there's a connection between fast twitch muscles, speed, and infections due to fungus or mold in the skin. That's interesting. Here's something else that's interesting. I used to have a copy of the wonderful book on running by Jim Fixx, F-I-X-X. Perhaps you remember the author. It was a bestseller, and for good reason. It was an inspiring book. And he became very famous and quite wealthy. He died at age 52 of, would you believe, a heart attack? Shortly after he was exercising. And after autopsy, it was found that the arteries and veins to his heart were severely blocked. Now, how could this happen with all of the exercise he was doing? Running marathons all over the place, and apparently doing pretty well. All of the exercise he was doing was slow twitch work. A lot of it. So what? Well, if there's no fast twitch work, then there's no exercise for the meridians. He wasn't depending on them. What is an artery or a vein? Is it basically a cylindrical layer of skin surrounding blood? What happens if that skin becomes infected with a fungus? Well, what happens to my toe when there's toe fungus in there? I see a lot of white glop in it, but it's kind of hard. What if the skin of the vein got hard and thick? Could the blood get through that? Well then, why can it happen? Because supposedly if zinc is in the body, it can't happen. Well, zinc is supposed to be present in good vegetables. At least if the vegetables are grown in good soil. And suppose we should get the zinc. Of course, if the vegetables are conventionally grown in worn out soil and feeded NPK to make them work, then, well, there is no zinc in the soil, so there will be no zinc in the vegetables. In that case, we are vulnerable. It might even be worse than that. Ordinary vegetables are nowadays genetically modified, and that means that they are modified so that the farmer can save money by using Roundup, an herbicide to kill weeds. So what? Roundup is well known to be a chelator. It chelates the fundamental minerals that the body depends on: magnesium, zinc. That is, a magnesium or a zinc atom is completely surrounded by this tightly bound cartridge produced by the Roundup. Now I'm talking about in me, but of course a certain amount of Roundup does get in me if I eat such a vegetable, or if I eat meat from a cow that ate such silage. In fact, it's been demonstrated that the Roundup does work its way through to us. It's been found in humans. Then, if I eat or have eaten in the recent past such a vegetable, the Roundup, and apparently it's extremely effective as a chelator even in tiny, tiny nanogram quantities. The zinc's not available. It's tied up in these little cartridges. In that case, I am absolutely vulnerable to any fungus that wants to come in. The infection will be there. Now, nowadays we are eating organic, strictly, and we're pretty careful about our meat too. And I'm putting lots of zinc on the skin, so eventually some of it should get into the rest of the body, and I assume that this will eventually help me get rid of the infection. And it should be very interesting. Back to Jim Fix. Was he killed because there was a fungus infection in the veins? Is this the cause of cardiovascular disease in the Western world? It's something to think about. Thanks for listening.
Yeah, that's a whole lot better, John.